Welcome to the Level 4 video, Conducting Staff Training in the Health Communications video series. This video focuses on options for WIC-designated breastfeeding experts, or DBEs, when they're conducting breastfeeding training for WIC staff. The WIC DBEs are often called upon to conduct training using the WIC breastfeeding curriculum for various levels of WIC staff. This training would be done at the direction of the local agency breastfeeding coordinator. Some options for training might be training new peer counselors and new WIC staff. They might do continuing education updates for peer counselors at staff meetings or as webinars. They might train CPAs to hone the referral and collaboration process when tailoring food packages for moms that are experiencing problems. Many DBEs provide education for staff at monthly lunch and learn events or as part of staff meetings. And often, DBEs simply provide one-on-one training for staff when certain breastfeeding questions come up. The flexible nature of the WIC breastfeeding curriculum makes it an ideal resource for tailoring training based on the needs of the agency and the participants that are served. DBEs will want to work with your local agency breastfeeding coordinator to identify topics most needed by staff and options for how to deliver that training. For example, one topic idea is to use the supplementation dashboard in the problem-solving platform. This discusses the roles of staff when mothers ask for formula. The mother-baby separation dashboard in the normal breastfeeding platform could be a great lunch and learn on how to support moms who return to work or school. Or the 3-step counseling principles in the counseling section could be reviewed at a staff meeting to refresh active listening skills. As we discussed in the Level 3 content, approaches that involve varied learning styles and that facilitate discussion are not only great for engaging WIC moms, they're also effective for staff training as well. You might want to select training topics that will build on the existing knowledge of your staff so they can take their learning to the next level. The WIC breastfeeding curriculum provides lots of ideas for facilitated discussion topics. It also includes interactive activities to make content meaningful and applicable to their staff role. Here's one suggestion. Ask the staff to decide their learning goals and what they feel they need to better support moms. You can use sticky notes or a flip chart and post all of the goals. Then, on a scale of 1 to 10, ask staff to rate their current knowledge of each topic to be addressed. You can narrow down the choices to the most important information that staff wish to learn. To make learning more memorable and enjoyable, use techniques that appeal to different types of learners. Tell stories to make the topic more personable and relatable. You might even invite WIC moms to come to your training and share their experiences with the topic. This can make it very personal and memorable. Use role plays to help staff practice counseling approaches. And use lots of hands-on demonstration tools such as dolls and breast models so staff can practice new skills. If your agency policy permits, consider opening up your training events to the community. When you involve other partners who also serve WIC moms, you can help create consistent messaging, build networking, and reinforce the role of WIC in promoting breastfeeding. Some partners to consider inviting to your training might be other health department programs, such as chronic disease or home visiting or case management staff. You might want to invite other government agencies in your community, such as a Healthy Start, Early Head Start, or even the SNAP program staff. You might also want to invite local healthcare professionals from hospitals and clinics who serve WIC moms. Community organizations may also appreciate being able to attend breastfeeding training. Think about staff in organizations who serve WIC moms. For example, minority health programs, teen mother centers, food banks, and homeless shelters. To wrap up this section on health communication, we invite Level 4 learners to use the handout WIC Staff Training Plan. Create a plan for how you might conduct a short training experience for WIC staff in your agency. Think about the most important learning needs of your agency staff. And think about which dashboards in the WIC breastfeeding curriculum might best help you deliver that information. Consider stories that might be relevant and some open-ended questions that could help you conduct a facilitated discussion. This ends the Level 4 content on conducting staff training in the Health Communications section. Please take a few moments to pull out your WIC Action Journal and turn to the Health Communications section. Write down something you did not know before this content was presented, and set at least one goal for something you will do with what you learned. Please complete the Level 4 post-test for this section and turn that in to your supervisor.